simplemente para anunciar que estaremos iniciando este webinar en unos 2 minutos. Hay una gran concurrencia y estamos habilitando la sala, así que en 2 minutos estaremos empezando, simplemente para garantizar eh, la presencia y la mayor participación posible desde el inicio. Muchas gracias. Buenos días a todas y todos nuevamente. Bueno, vamos a iniciar este webinar tan esperado. Mi nombre es Ernesto Báscolo, soy el jefe de la Unidad de Atención Primaria de la Salud y Prestación Integrada de Servicios de Salud de la Organización Panamericana de la Salud, y es un honor darles la bienvenida a este seminario virtual de lanzamiento del itinerario formativo en atención primaria de la salud y del curso Introducción a la atención primaria en el siglo XXI, principios e implementación. Antes de comenzar, quisiera compartirles algunos aspectos logísticos. Este seminario cuenta con interpretación simultánea en inglés, en español, portugués y francés. Pueden seleccionar el idioma de su preferencia haciendo clic en el icono del globo en la barra inferior de Zoom. También contamos con interpretación a sistema de signo internacional visible en todo momento en su pantalla. Este evento está siendo grabado en todos los idiomas y lo dejaremos disponible en la página del evento en los próximos días. Además, les invitamos a enviar sus comentarios y preguntas a través del chat en cualquier momento. Estas serán recogidas por la ronda de intercambio al final de las presentaciones. Este evento representa un paso fundamental en nuestro esfuerzo regional de la Organización Panamericana de la Salud para fortalecer la APS como una estrategia central para avanzar hacia sistemas de salud más equitativos, integrados y resilientes. El itinerario y el curso no solo son actividades académicas, esto queremos resaltarlos, son herramientas concretas que permitirán a profesionales y equipos de salud adquirir las competencias necesarias para responder a los desafíos actuales y futuros, para servir como base en los procesos de formulación e implementación de políticas de atención primaria de la salud. A lo largo de esta sesión vamos a conocer la estructura del itinerario y del curso, y conoceremos también las experiencias de Colombia y de El Salvador, que muestran cómo la formación en recursos humanos, pero especialmente en atención primaria de la salud, se traduce en cambios reales en los servicios de salud y en la vida de las personas. Bueno, para empezar entonces, le doy la bienvenida a Isabel Duré, consultora internacional del Campus Virtual de Salud Pública de la Organización Panamericana de la Salud, que nos enseñará el nuevo itinerario formativo en atención primaria de la salud. Isabel, por favor, tenés la palabra.
Gracias, Ernesto. Bueno, buenos días a todos. Voy a compartir una presentación. Me van a decir si se ve.
Sí, se ve.
¿Se ve
Muchas
bien?
gracias.
Perfecto. Bueno, antes que nada les quiero traer el saludo del jefe del programa del Campus Virtual de Salud Pública, que hoy lamenta no poder acompañarnos. Voy a presentar los itinerarios como nuevos desafíos y a la vez como una respuesta a los procesos de educación en salud pública. Para los que no nos conocen, el campus virtual es la plataforma educativa del OPS y una herramienta estratégica para la cooperación técnica y para la educación de los profesionales de salud de las Américas. El campus nace hace ya más de 20 años y ha sido pionero en la región, tanto en los desarrollos tecnológicos como en el uso de recursos educativos innovadores. Esto le permitió al campus dar respuesta al proceso de virtualización masiva que tuvo lugar durante la pandemia, pero también permitió seguir creciendo durante la pospandemia. Ustedes pueden ver aquí que ya hemos alcanzado, superado los 4 millones de usuarios y también que contamos con más de 10 millones de matriculaciones. Esto muestra que en promedio nuestros usuarios realizan entre 2 y 3 cursos. O sea, vuelven al campus virtual en búsqueda de oportunidades de capacitación. Lo que ustedes ven aquí es nuestro portal regional. El portal alberga permanentemente 100 cursos, más de 100 cursos de autoaprendizaje que involucran a todas las áreas temáticas y todas las áreas técnicas del OPS. Los cursos son gratuitos, se revisan y actualizan cada 2 años. Y además, es importante destacar que el campus es el punto focal en la región para la Academia de la OMS. También el campus ha desarrollado un modelo para la gestión descentralizada de las propuestas de capacitación, que llamamos los nodos de país. Estos nodos facilitan la adecuación de las propuestas educativas a las necesidades de cada país, articulando con la cooperación técnica. El campus cuenta con un enfoque educativo que propone la utilización de la educación permanente de la salud. El principio de la educación permanente de la salud es la jerarquización del proceso de trabajo como fuente de aprendizaje. O sea, consideramos que la formación es en, por y para el trabajo, con el objetivo de transformar las prácticas en los servicios. Esto implica el desarrollo de propuestas situadas y un diálogo permanente entre la realidad y el abordaje a partir del desarrollo de competencias. Ahora vamos a entrar un poquito a hablar de los itinerarios formativos. Los itinerarios formativos nacen en el contexto de nuevos marcos educativos de la UNESCO y fundamentalmente de la propuesta de educación a lo largo de la vida. ¿Por qué? La pandemia puso en evidencia la necesidad de actualizar los modelos de formación para dar respuesta a entornos cambiantes. Perdón, yo lo estoy viendo en mi pantalla, ¿ustedes la ven?
Sí, se ve muy bien.
Sí, se ve. Perfecto, yo dejé de verla. Entonces, para dar respuesta a entornos cambiantes en donde los modelos académicos tradicionales se tornaron insuficientes. Entonces aparece un nuevo paradigma que integra un modelo de alternancia entre lo que es la educación formal, la educación tradicional y la educación no formal, que está proponiendo, a su vez, un trabajo colaborativo e interinstitucional. Los trabajadores de salud van transitando a través de distintos escenarios en los que se produce su aprendizaje. Muchas veces el aprendizaje se produce en los lugares de trabajo. Y estos tránsitos pueden ser reconocidos a partir de toda una propuesta de sistema de créditos y microcredenciales que puedan dar cuenta de esta calidad del aprendizaje y a la vez que se vayan integrando entre ellos. Entonces, ¿cómo definimos desde el campus virtual un itinerario formativo? Porque nosotros comenzamos a trabajar en estos itinerarios como parte de una transformación de nuestra oferta formativa. El itinerario es un recorrido que jerarquiza, que ordena una serie de acciones formativas, como cursos, webinarios. A ver, no se trata, o sea, la propuesta es que no se trata de dar cursos aislados,
The
¿no?
proposal is
Sino
not
que
to
uno va
have
haciendo
isolated
itinerarios
courses.
formativos, se realizan
The
acordes al
training
desarrollo de perfiles de
itineraries take
competencias
place according to
definidas para un
competence
ámbito
profiles
profesional específico.
defined for
Entonces, esta
particular
propuesta del itinerario formativo
specific
evita la
fields.
exclusión
So
y
this
permite
proposal
encuadrar
would likes to or aims
diversas
to
solicitudes
frame
que van apareciendo
several
a través
requests that we
de los
received
países y los
through
diferentes
the
institutos que
countries
trabajan
and
con el
the
campus
technical
virtual.
areas
¿Cuáles
that
son
are
las
involved in this.
características de un
So what
itinerario
would
formativo?
be
Bueno, en
the
principio se
features
encuentran
in this
alineados
case?
con las
Well,
políticas de la
we have an
OPS que han
alignment
acordado
with
los
the
países.
OPS
Son
policies
itinerarios
from each
dinámicos
country,
orientados a los
and these
problemas de la región.
are dynamic itineraries oriented
Integran,
towards the problems of the region.
integran distintas ofertas
And
de
we
formación de diversas
integrate
modalidades e instituciones.
several
Y bueno, fundamentalmente este tema de que
offers
son
from different
dinámicos,
institutions.
evolucionan.
And
Son,
this is
pero
dynamic.
además son
They evolve, and it's something that we could easily certify.
Estos son los 4 itinerarios de
These are
campus
the
virtuales que
4
tienen
itineraries
disponibles
that
en
the
este
virtual
momento.
campus
Entonces, acá ven
has in
el
availability
itinerario
at this
para
moment.
evaluación
If you
de
see,
tecnologías, el de mejor atención
there's
para
an itinerary for
transmisión
improving
científica, el
technologies,
itinerario formativo en salud
improving
pública,
care
el
for
itinerario que
transmittable
estamos presentando
diseases,
hoy,
and the itinerary that we're introducing
es
today,
itinerario de
which
atención
would
primaria de la salud.
be primary
Si ustedes
healthcare
pueden
attention or
ingresar,
care.
van a ver que
If you
cada
go
uno de estos itinerarios,
in
ingresen acá en la
these
derecha, van a
itineraries,
encontrar que
you're
hay
going
como
to be able to
denominadores comunes.
see
En principio,
that
se
there are
presentan
common
las
denominators.
competencias
We have
esperadas a desarrollar por cada uno de estos
these
itinerarios.
competences that
Están
are
identificados y
introduced according each
vienen
itineraries.
identificadas por
So you're going
periodos
to be
de
able to
identificación. A
determine
su vez,
some
tienen,
competences for
cuando ingresan a cada uno de
recipients.
los
Once
destinatarios,
you
se
enter each
identifica
one of
una
them, you are
propuesta
going
de
to
cursos a
identify
seguir
proposals
de
of
una manera
courses
ordenada, que bueno, puede hacerse
in
de
a
esta
coordinated
manera o
way. This could
todos los
be
participantes pueden
in this
elegir cada uno,
fashion,
pero es
and
un
other
itinerario
members
coordinado
could
que se complementa no solamente con
choose
cursos, sino
others.
además con
This is
ciclos y
complemented with
modalidades. Ejemplos,
courses
estamos ahora
and different modalities. For
proponiendo,
example, we are
proponiendo la
proposing
incorporación de una serie de
to the
ciclos de webinarios
incorporation
que son seccionales,
of
no webinarios por ahí
a
tradicionalmente
series
se hacen, sino
of
que
webinars
son ciclos de
that could
webinarios
be
que
certified.
incorporan distintas
And
características y
they
actividades a
would
partir
incorporate
de lo que se escucha en el
certain
webinario
activities and
para
features
avanzar en un
according to what
proceso
you
de
hear
certificación.
in order to move forward with the certification process.
Y bueno, aquí ven el
Well,
proceso que hemos realizado para la
here you
construcción
have
del
the
itinerario
process
formativo en APS, que
in
es el
order to
proceso
build
común
the
que tenemos para todos
training
los itinerarios. Que
itinerary.
bueno, pueden ver en
This is
principio
a
que
regular
lo más importante y
process.
fundamental es que
You're
es
going
un
to be able to
trabajo
see that there are
interprogramativo
main
e
aspects, and this
intersectorial.
is
¿Sí?
a
En este caso
cross-sectional
participaron en el
and
desarrollo de este itinerario de APS,
interprogrammatic
participaron las unidades de APS, de
agenda.
recursos humanos
We
y el
have
campus virtual.
the primary
El
care
recorrido
unit
metodológico para la construcción del
intervention,
itinerario propone analizar
and
documentos, en este caso
this
el documento
includes analyzing
más
documents.
potente que se ha utilizado es el marco operacional del
The more
APS,
powerful
y a
that we have
partir
used is
de
the
estos
operational
análisis de
framework of
documentos y esta experiencia se van
primary
identificando
healthcare. And
competencias,
from
se van
this, we're going to
identificando
start
destinatarios
identifying
y
competences,
se revisa
identifying
todo el
the
material que está disponible.
destinataries,
También se
and we're
analiza
going
sobre
to
este material de
analyze
competencias.
all of the
Entonces,
available
una vez que
resources according
está
to
realizado
competences
este
as well.
análisis, se
So
propone una
once we
jerarquización de
perform
tecnología
this
y organización.
analysis,
Y
we're going to
además
have a
tenemos funciones que aparecen
hierarchization.
brechas,
And we're
identificamos
also going to
brechas
have
y nuevas
gaps
necesidades
and new
para
needs
incluir en estos
to be included in
itinerarios que se
such
van
itineraries,
incorporando progresivamente. Bueno, aquí
which is
estamos
going to be
representadas
progressively
cursos
incorporated.
de
We are
APS, que
going to
fue una de las
include
identificado
APS
como una
or
necesidad
primary
cuando
healthcare
comenzamos a trabajar
course, which was
el itinerario
identified
que se llama
as a
elegido
need
por nuestra
once we
dirección.
started
Y
working in
bueno, y
this.
ahora que
This
ingresamos
was a request by
específicamente
our
en el
manager.
itinerario de
And
APS, como
of
ustedes ven,
course, this would
cuando
be
ingresan
the
a la página
training
web
itinerary
del
as
campus
such.
virtual, bueno,
And once
encuentran
you
un
enter
banner
this
que
website,
propone la
you're
entrega de los
going to
itinerarios. Cuando
see
ustedes ingresan a los itinerarios, buscan el itinerario formativo en APS,
an action, a
seleccionan allí y
clicker
allí se despliega
to
en estas capturas
enter
de pantalla, bueno,
all of this
el
information.
itinerario
And once you
que
click on it,
especifica cuál
you're
es
going
el
to see
propósito, a quién está dirigido. En
these
este caso,
images, for
tenemos
example,
tres
what's the purpose,
destinatarios identificados
which is our target audience, for example, intersectorial teams, professional teams, and managers as well. So the competencies that are expected are included here, and according to the destinatory, for example, I'm going to use the intersectorial team, and you're going to be able to see the course offer according to the teams. And we're going to be able to see this according to the components of primary healthcare. You will be able to see all of this information, and the proposal is to have the introduction to primary healthcare on the 21st century. This is the first course that you should have. And to finalize, I'm going to do a small summary according to the opportunity of these itineraries. We mentioned already that it hierarchized for a training, and at the same time, it helps us strengthening the interinstitutional work. It enables us to adequate to different itineraries. Since they're flexible, we are able to grow and adequate to context. Like, for example, country notes that could add particular components of certain countries. We could increase communities of learning, and we could move forward towards a system of evaluation and certification of credentials, which could be replicated by academic institutions, universities, and such. This is all that I wanted to say. I want to say thank you. Thank you, Ernesto, and thanks to all the attendees. I want to thank also for the hard work. It was not only technological work, it was educational, communication, and design work involved. Thank you. Thank you, Isabel. Like you were saying, for all the virtual campus team, a particular thank you, but I also wanted to thank you for introducing such itinerary, because this is a true milestone, not only for PAHO, but also for the primary healthcare unit. And with a heart-warmth thank you, I want to mention that this is a flexible project and progressive that is adapted to different contexts, to different entities, and different actors or key characters that are involved in the development of the primary care unit. And now I would like to introduce Gustavo Rosel de Almeida. He is a regional advisor on integrated health services, and he's going to discuss the course, introductory course to primary healthcare on the 21st century. These are the principles and implementation features. I would like to mention that we have more than 1,100 attendees connected at the moment. This is not to make you nervous, Gustavo, but we have a huge attendance record from all countries in the Americas. You are on the spotlight now. Thank you, Ernesto. And I would like to salute everybody that is watching us right now. And for the people that are going to look at the recordings, I also want to say thank you. And now I want to share briefly, I know that I don't have much time, but because you're going to start discovering everything that is happening in this course. After 47 years of the ELMACAN International Conference, we are going to turn 50 in 3 years. We see a context that is changing. I'm sure that you're going to be able to see this in the information of the course that I'm going to introduce. this course. It's called Introduction to Primary Healthcare Attention on the 21st Century, Principles and its Implementation. This should be a setting point of this training itinerary that Isabel showed. It is highly advisable for you to start with this course because you're going to have a conceptual framework, some terms or concepts that are used in a certain way. We want to have homogeneous concepts. We should not say, okay, this is the only concept. We want to say, okay, this is going to give you an idea of the context that the conference was held and also the current context in which we're going to develop the new strategies as a way to continue moving forward on universal health. The learning objectives would be to identify history and contextual factors when it comes to primary healthcare on the 21st century. For conference Alma Ata, understand the integration, accessibility, participation principles of the primary healthcare unit established on the Alma Ata Declaration, acknowledge with different particular cases the fundamental concepts of primary healthcare with its strategic natures. We need to understand how was this applicable for each of the countries, how do we actually understand it, how did we evolve. We also need to identify operational levers that strengthen and visualize implementation when it comes to successful experiences of countries in our region. Who are the or who would be the objective public or destinataries of this course? Would be all workers, professional healthcare workers, and unprofessional workers. These would be community leaders throughout the diverse institutional levels and healthcare attention. This is a wide range. Therefore, we have adapted language for it to be properly understood within the different execution levels. The hours for the course, basically this is an open course, it's a self-to-manage or self-taught. This is composed by 5 learning modules that should be taking place approximately in 16 hours, we should say. Contents are consisting of models. The first model discusses the background, basically, of primary health care. We understand, of course, that primary health care is the essential care when it comes to health. And first, we're going to discuss the context of Alma Ata. We were finishing the Cold War after the Vietnam War, and 3 years after such conference, the world faced a new pandemic, which is the AIDS pandemic. And 4 years ago, there was another pandemic, which is COVID-19 pandemic. So this is a whole reflection on how we were implementing concepts and the operation aspects of health. It includes also implementation of governments or administration, if they were focused on primary healthcare or if maybe they were working on a view that will be more hospital-centric. This is the first module. We are going to be able to reflect a little bit, and we are going to consider a new context. And this would even include the pre-pandemic. We are now in a post-pandemic world, so I'm sure that we're going to be able to adjust some of the action lines. We also need to understand the components and strategic mechanisms, which would be module 2. This aims to generate commitment, political leadership, because we know that the political leadership enables to strengthening primary healthcare attention. We have governance and policies framework, financing and resource allocation, involvement of communities and other stakeholders. which would help us modulate our healthcare module. We need to have different acting or key roles, not only on health and diseases. Model 3 would include operational mechanisms, like I mentioned, the care unit, the primary healthcare personnel, physical infrastructure, medicine, among other sanitary products, and collaborating with the private sector. We would also be able to see, please, I would like to ask everybody in the room to turn off their microphones.
Mayra Erazo, por favor, se le escucha.
Mayra Erazo, would you please turn off your microphone? Okay, we have a procurement and payment system. We are live, so these are things that could happen. Okay, so we also need digital technologies for health that would enable rich people and patients as well.
Y el monitoreo de evaluación. Todos estos son los mecanismos operacionales que permiten fortalecer la atención primaria de salud.
All of these are aspects that would enable us to strengthen care within different contexts and levels. We have Module 4, which will be challenges and opportunities that I was just mentioning. How are we going to manage the territories, deployment of primary health care on the territory, the service life, among other actions that we're going to take, which is the focal point of primary healthcare unit. Social key factors of health, which include governability or governance and resilience as well, in order to adapt the difficulties that the context could have. This is really important to consider. And as you can see, this is a broad course. Finally, we're going to discuss the training itinerary that was introduced by Maria Isabel. This itinerary will be the road to strengthening the competences of the healthcare workers. This is not a course only, this is a way to accompany our health workers for them to develop competences and implement primary healthcare. This would be what I wanted to tell you. I wanted to tell you that this course has an assessment. In the end, they should be evaluated, which would be subject to a 7% approval score. And we would expect you to be involved in order to have feedback on primary healthcare in our countries. I wanted to mention that we have lots of people that have enrolled in the course, and we hope them to be more. Thank you. We cannot hear you, Ernesto.
Perdón. Muchas gracias, Gustavo.
Thank you, Gustavo.
Thank you very much,
You
Gustavo.
have
You
handled
managed all this very well.
disruption properly. And just to give some context, we have more than 1,200 people that have connected at this moment.
1,200 people connected right now. And I believe that the content and the pertinence of this course, it gives it a lot of sense to interpret the history of primary health care in our region and the emphasis on the strategies for primary health care and the possibility of reform and change our health systems today. So
de esta modalidad
It's not
de
only
curso
the type of
autoadministrado con un
course, it's a
nivel
self-administered
de ya
course,
inscriptos que superan los
and we have
5.700,
more
como bien
than
decías vos, sino también la
30,000
posibilidad de
people
poder
that have
encontrar en este curso
taken
esta
this course,
combinación desde
but we can
puntos
also
de vista
find
más
in this
conceptual e
course
históricos y
the
prácticos.
possibilities of putting
Incluso dentro de
together
esta
the
perspectiva
theory and
de un
practice
proceso
from
de
this
formación
perspective of
que encuentra
an
este
educational
dispositivo, este
process
espacio como
that
una primera
finds this
etapa
space
en
as a
esta
first
concepción de
stage, that
trayectoria, de
considers this
itinerario.
space as a
Yo
first stage
te,
in an
te
itinerary, in a
felicito
formative
porque
itinerary.
además de
I
presentarlo,
congratulate
Gustavo
you
fue el
because apart
responsable
from
técnico del desarrollo de este
uh,
producto que para mí es
explaining this
fundamental.
product,
Así
he
que
was
te
also,
agradezco muchísimo
Gustavo
la
was also the one
presentación.
who developed it.
Ahora,
So I
a
thank you very
continuación,
much for the
los invitamos a ver
presentation,
un
and now we
video
invite you to see a
preparado por el
video
Nodo
prepared
Colombia en
by
Campus Virtual de
the
Salud
Columbia
Pública, en el que se
Note
comparte la
in the
experiencia
public
de un
health
piloto
campus,
probador de
where we
itinerarios
see a
formativos, en
pilot
este caso en salud mental.
itinerary
Que
for mental
agradecemos
health.
al equipo de Colombia por
We
mostrarnos
thank the
cómo un
Colombian team
itinerario
for
puede
showing us an
adaptarse a la necesidad
itinerary and
específica
how this
de cada
itinerary
país
can be
y
adapted to a
generar
specific needs in each
aprendizajes
country
concretos.
and generate
Por favor, colegas.
concrete learning experiences.
No se escucha todavía, ¿eh?
We can't hear it
El
yet.
audio, María.
Audio, please. Maria?
Lamentablemente no se escucha.
Unfortunately, we
El
can't
campus
hear it.
virtual de Nuevo Colombia.
Ahora sí.
Cordial saludo
Now
para
it's good.
todos.
Greetings to everybody.
Cordial saludo para todos, para todas. Yo soy Juan Fernando
And
García, soy consultor
I'm
nacional de
José
sistemas y
Fernando
servicios de salud
Garcia.
de la OPS OMS en
I'm
Colombia
a
y acompaño el
consultant
desarrollo del campus
for
virtual de
PAHO
Nuevo
in
Colombia en la
Colombia
organización. Voy a
and
compartir
for
brevemente
PAHO
unas
and
lecciones
to the
aprendidas,
WHO,
algunas
and we will
experiencias
tell
de lo
you
que
about
fue
some
la
experiences
implementación del pilotaje del
and
itinerario
lessons
formativo de
learned
salud mental que
with
desarrollamos
this
como Nuevo Colombia en un
educational
trabajo
itinerary that
interprogramático con
we
el
are
campus virtual
implementing in
en este
Colombia
año
at the virtual
2025.
campus in 2025.
Es importante
It's
iniciar reconociendo
important
de
to
que Nuevo
start
Colombia tiene
by
una gran
saying that
fuerza en la
Colombia has
descentralización por medio de universidades. Son seis
that
universidades
healthcare has been
socias de nuestro
decentralized
Nuevo
in
Colombia
Colombia,
y
and
están
also the
distribuidas en
educational
diferentes regiones del
services have
país,
been
lideradas por el Ministerio de
decentralized
Salud y
and take
Protección
place in
Social como la
different
entidad
regions of the
rectora
country.
y la
And
OPS como
so we
secretariado
have
técnico.
the
El nodo
Ministry of
intenta dar
Health
respuesta a las necesidades que
as
emergen todo el tiempo en las
a main
transiciones del
entity
sistema de
and
salud, las transiciones
government entity,
demográficas y las transiciones
and
propias
well,
que van ocurriendo en el territorio
there
nacional.
are different
En este caso, en el Nodo Colombia, ha
different
considerado
nodes
la iniciativa de
in
implementar un
the different
itinerario
regions.
formativo en un
We
trabajo de dos
have implemented
universidades.
this
Una,
educational
la ubicada en la
itinerary
ciudad de
together
Cali, la
with
Universidad
two
Libre, y otra, la
university,
Universidad de Antioquia, ubicada en la ciudad de Medellín.
the Free
Estas dos
University
ciudades
at Cali
capitales
and the
de
University of
Colombia
Antioquia.
han
These
tomado
are
la
the
iniciativa y
ones,
el
the two
liderazgo bajo el
universities
apoyo
in
de los
Colombia
demás
that
actores
have
y
taken up
nosotros
the
como
leadership
secretariado
in this
técnico
course.
de
And we,
atender las
as the
particularidades
technical
propias y las
secretariat, have to
prioridades
take
que le ha
care of the
dado Colombia
priorities that
a la
Colombia
dimensión de la
has
salud mental.
assigned to
Es así
mental
como se ha
health.
estructurado un pilotaje de un
So we
itinerario
have
formativo,
structured a pilot
considerando la
course,
necesidad de cambio, la necesidad
considering the need for
perentoria
change
de
uh,
actualizar las competencias
and
esenciales
for
para la práctica de
updating
salud mental y
our
darle capacidad
theory
de
and
resolución
practice,
en ese
and
perfil del
also
psicólogo,
provide
sobre todo para la actuación en los primeros niveles de atención,
priority
empezando a
to
hacer
mental health
un
care
análisis de un itinerario
by
formativo
starting with an
donde
itinerary
estas dos
for a
universidades
formative
hacen una
course.
pesquisa,
And
una
these two
revisión de los contenidos de
universities
los cursos de
have
autoaprendizaje que
reviewed
están
the courses
disponibles en el campus
available
virtual de salud
at
pública
the
y
virtual
considerando
public health
una
campus
formación
and
estructurada que se ha dado desde la
taking
región, de algunos
account
países,
also
inclusive
the
desarrollos propios de
experiences for
Colombia,
other
y se hizo
countries
esa
from other
revisión detallada de
countries
todos
and
los
also from
contenidos
Colombia.
en el campus
And
virtual. El resultado de ello
the result
fue
of this
integrar un itinerario
has been
formativo
to
de 5
integrate
módulos
this
donde se
educational
relacionaban
itinerary from
competencias
different
esenciales que
sources.
debería tener un
And
profesional de la
so
salud mental
we
que
are
se forma
including
y que está en ejercicio propiamente en Colombia, y en particular en el primer nivel
the
de atención,
different
teniendo
regions
mucha
in
fuerza
Colombia, and
para hacer
especially the
resolutivos.
focus especially on the
El
primary
pilotaje del itinerario
health
formativo en este
care.
recorrido, que ha
And
sido
the
anidado en
pilot
diferentes módulos
courses that
agrupados
have
por los
been
módulos
divided into different
que están disponibles en
modules
el campus virtual,
and
además
are
de contar
available
con estos
here at the
cursos de
virtual campus.
autoaprendizaje y de
There are
tener
also, and these are
entre 2 o
self-learning
3 cursos
courses
por cada
also.
uno de
They
los
are
módulos, como lo
self-learning
ven en
courses
pantalla,
also.
pues teníamos la
And
posibilidad de
so
integrar
these courses gave us the
tableros
possibility
de
to
información,
integrate
dashboard, publicaciones,
the
podcasts,
different
diferentes
parts,
webinarios del
dashboards,
país que fueran
webinars,
importantes y
etc.,
relacionados al tema actualizado que se está
related
abordando en cada
to
una de las secciones o cada
different
uno de los módulos, y que
parts
sirviera
of the
para que los
modules,
participantes pudieran
in order to
entremezclar ese
allow the
saber
participants to
conceptual
put
con la
together this
implementación y la
conceptual learning
territorialización de
with
ese
the
conocimiento propio, que
different
es tan diverso, tan
special
distinto,
courses
y
on the
que
different for
requiere
different
esa
territories.
emergencia del proceso
And all
formativo
this is
educativo.
part
Los
of the
webinars,
educational
adicionalmente,
itinerary. The webinar
fueron una intencionalidad importante de ir
uh,
cerrando, ir
also
concluyendo cada
aimed
uno de los
at
módulos, y esos webinars desarrollaron un cierre en un tiempo
finishing each one of the
específico, donde
modules
invitábamos a un experto
and
nacional de los territorios con
um,
una temática
also by
específica relacionada con
inviting
esta dimensión,
experts from the
y
different
entablábamos y
regions with
abordábamos
a
de una manera
distinct
tipo
experience
conversatorio,
in the
de una manera
region.
más
And
horizontal y más
so
fluido
this
con los
provided a
participantes,
more
un diálogo que
horizontal
fuera
way of
haciendo la
interacting with
relación
the
con los
participants.
contenidos que se veían en
It's,
cada uno de los
these
módulos.
became
Este pilotaje
transversal
ha sido
courses.
una articulación
These
muy
pilot
interesante,
courses
ha tenido
have
una
been very
evaluación antes,
interesting.
durante,
It
después.
has been
Hoy
assessed
estamos terminando de
before,
hacer las
during, and
evaluaciones
after
finales, porque esta
each
experiencia de
course
itinerario formativo acaba
because
de
this
culminar el mes anterior, en
experience,
el mes de
well, just
julio,
ended
y las
in
experiencias han
July
sido muy
this year,
enriquecedoras.
and the
Son
experiences have been
98 estudiantes de pregrado de psicología y de
very
posgrados en un nivel
informative.
de maestría
We
que están en esta
had
cohorte
teachers
que hemos llamado de
with
pilotaje, y hemos podido
university degrees,
evaluar y
even master
identificar
degrees,
resultados
and
muy
we were able
esperanzadores
to
para lo que es este
identify
tipo de
very
formación
um,
innovadora, para que estos
inspiring
tipos de itinerarios
results
formativos puedan
for
replicarse no solo en el ámbito de
for
la
being
salud mental,
replicated
sino que pueda escalarse en el campo amplio de
and
la salud
scaled
pública en
up
diferentes
at the
dimensiones.
broad
Muchas gracias
public
por la
health
atención.
campus. Thank you very much for your
Bien,
attention.
quiero
Thank
agradecer
you. I would like
nuevamente
to thank
a todo el
again
equipo
the whole
de
team
Colombia. Me
of
parece
Colombia.
un excelente ejemplo,
I believe that
porque
this
no
is a
solamente
very
aterriza con esta concepción
inspiring example,
interdisciplinaria
very an
en el
excellent
contexto de
example
determinado
that
territorio,
focuses not
sino
only
al mismo
on
tiempo sobre
primary
una
health
determinada
care in a
problemática en
territory
particular
and also
y
focuses
cómo
on
utilizamos el itinerario como un
certain type of
abordaje
problem. And we use this
práctico,
itinerary as a sort of
involucrando
starting
actores,
point
dándole sentido
by
y
involving new
fortaleciendo
actors and
capacidades.
providing
Bien, también quiero
strengthening of
mencionar que
capabilities, of skills.
siguen
I also want to
incorporándose
say that
participantes a este
we are
encuentro y
still
la
welcoming
verdad que no
participants to
puedo
this
estar
meeting.
mencionando todos los
And
países que
well,
están
I
incluidos
cannot
porque creo que
mention all
están
the
todos los
countries that
países de
have
la
been
región
included, but I believe that we
directamente.
have
Así
all the
que
countries in the
ha
region.
sido
So it
una
has
actividad de
been
difusión con un gran
an
éxito
activity
y es lo
of,
que tenemos en este momento. Y
well,
qué buen
spreading
momento
knowledge that is
para
very
presentarles a un
important.
colega, Benjamín Puertas.
And we want to
Él
introduce
es
now a
jefe de la unidad
colleague,
de
Benjamin
recursos humanos
Portas, who
para
is
la
the
salud,
head of
también
human resources
en
for
nuestro
health
Departamento de Sistema y
at
Servicios de Salud.
our Department of Systems and Services for Health, and he will tell us about the need to strengthen competences in primary health care as a priority to transform the healthcare systems in the region. Please, Benjamin, you have the floor. Thank you, Ernesto. I greet you all because it's a great opportunity for me to reach such an important number of colleagues and friends, and I will talk about the strengthening of competences for human health resources, human resources in health, and I will talk about the educational itinerary where PAHO has not only covered one area, but several areas. And so we had to, well, we were able to make progress together. And this is very important. So let's talk about the challenges for developing the skills of human resources. At the virtual campus, we have seen that in many countries of the region, we have seen it with our own eyes in several countries of the region, and we see that, and we also saw the need for further skill development to provide appropriate care to our patients. And I'm talking here about schools of nursing and medicine and different careers in healthcare. And the interprofessional approach is still it's not enhanced as it should. And the accreditation is also inconsistent in our training programs. And there is also a lack of research, and this is a chronic problem.
No están pasando las diapositivas.
The slides are not not changing. And sorry, Benjamin, but you don't have it in presentation mode. Well, that's strange. Let me see if I can do something.
Y aquí me aparece como presentación, pero entiendo que usted no lo está mirando como tal.
Claro.
Well, I don't know, and it appears to be in the presentation mode, but maybe you could close it and start it again. I'll try to do it. Apologies, please, and let's try again. Well, don't worry, this happens.
Si se mira el slide 3.
Are you seeing slide number 3? Yes, but not in presentation mode. No, still not. Though we see that you are trying to click on it, it's not working. So I would suggest that you just go through the slide and just leave it like that, because it's the only option I have. So we were talking about the main challenges that are here on this slide, and primary health care as the best way to overcome these barriers, and to also and to the continuity of services to the community, and the virtual campus as the best way to do it. And so what kind of healthcare providers do we need? And here we see that this is a very complex question. Here you can see what is happening, where we have a broad range of professions and categories, work categories for healthcare providers. And we have the traditional ones that we can identify as professions linked to medical services, such as family doctors, physicians, nurses, midwives. But there are a series of actors that are key and that are becoming more important for primary health care, such as the community volunteers and volunteers that reach out to families. And this is an issue that is not much talked about in the countries, although it is growing as our population ages. And then we have dentists, psychologists, pharmaceutical specialists, etc., a whole range of health specialists that goes beyond mere health and also includes other professionals. So let's go here to this slide. What other new skills and capacities that healthcare providers should have for primary healthcare? Well, the competences are there. It has just been a process to identify them as such. And here we see the different areas for these skills. There are 6 areas, and it's not only the technical part regarding the development of these skills, but also skills for making decisions, for cooperating, for taking into account evidence, for personal behavior, and the care, people-centered care. And well, you can see it here on the source that is mentioned at the bottom of the screen. And we need to put our people in the center of all our practice and provide respectful and sensitive care from a holistic point of view. And if we go to the other competences or skills, and here we're talking about making decisions, for example, and this is not only in health, but in other areas also. And the same applies to cooperation, to problem solving, to conflict solving, and to adaptability. And these are fundamental skills that should be present in a professional team focused on professional and primary health care. And you have to practice active listening, for example, and manage the use of data and develop skills for cooperating and establishing a confidential relationship. So conflict solving is also very important. Practices based on evidence that is and the personal behavior where ethics is an important factor, and also our own health and well-being, which is something that we tend to forget. And within this proposal, we're talking about 3 fundamental points that allows us to transform healthcare education. And so we have education and interprofessional training, education based on skills and the integration of digital tools and artificial intelligence. Education is and interprofessional skills training is very, very important because this is the way of putting together a team. And we have to establish, because to establish a collaboration based on nothing else, it's very difficult. And this is very well explained in the 2030 development goals, where it is identified about the development and strengthening of capacity of healthcare teams or staff to tend to the priority health needs of the population and prepare response for emergencies of public health is also included. So we need to update our skills based on empiric data, and our public health campus is a great means of strengthening our cooperation. And this is, well, I also want to say that skills in primary health care are not only related to technical aspects and the application of certain techniques for the healthcare of people and communities, but they are also based on the primary healthcare team, because they have to develop communication skills and also look at skills that are centered on people and to respect. And this is also a perspective where primary healthcare works. So I would like to thank Ernesto because this webinar is fundamental for broadening our perspective, and I want to invite you all to participate in this course, to register, to make time for it, and to acquire, in order to acquire a broader view of primary health care. And I also want to thank our teams, our work teams, and we hope also for the continuous support of our initiative. Thank you, Benjamin. And for me, one of the main issues when interpreting the complexity of primary healthcare issues, where human resources are the main actors in order to advance towards our goals. And it's not only technical skills, but also political skills. And in this way, we could be recognizing not only the possibility of setting up teams and to involve ourselves and lead processes, and they are, well, they are based more on macro view or meso point of view. And so, well, 1,300 people are connected right now, and many of the colleagues that are present are people that are really engaged in these processes. And it's great to see that we do not only have this product and this proposal, but that we are also able to build these dialogue spaces. And so I want to welcome Dr. Mayra and Patricia Razonaba and Nidia Teresa Caño Flores, who heads the comprehensive care for the elderly in El Salvador. They will share the experiences of their country, El Salvador, especially about virtual education that can be and how it can be aligned with the national health priorities. Dear colleagues, you have the floor. We are sharing the presentation already. Thank you, Rosana. Dear colleagues of El Salvador, you have the floor. Well, good morning. Thank you very much for the invitation. For me, it's a great, I'm very proud to show you all the progress made in El Salvador, in our case with the HEARTS package and also palliative care at the virtual campus. Well, We start with the hearts package, and here the heart strategy. And well, in 2021, it was officially recognized by our authorities that we would take part in it, and with the cooperation, of course, of PAHO. And then we sent a document to the primary healthcare in order to make it a mandatory way of caring for patients. And we incorporated human resources. We're talking about nutritionists and nurses and other healthcare professionals. And in 2022, we trained our team for setting up the national program, and these are the ones that decide all the policies, etc. And in 2022, we started with the clinical way. We also distributed equipment among and teams in our 6 regions of healthcare, 5 regions. And so we improved the quality of our hearts implementation. And here I show you how we chose the human resources for the heart strategy. And here we see the training for taking blood pressure, and there is a diploma at the end of the course, and we are making progress with that, and the physicians are being trained, and they learn learn the new techniques in what they had been doing for years. And then we have nurses, of course, we are also training our nurses, and we also provide a diploma at the end. And with this, we have reached the administration of medication by nurses by following the heart's itinerary. They have to acquire the diplomas in order to be allowed to acquire to provide this type of care. And here we see how many professionals have registered for the course, and the number of certified people. And it's the same also with the other courses. Next slide. Here we have the follow-up of human resources that registered for the course, and here we see the training provided by the nursing staff, even those who are not nurses, because we're also training the doctors, the new physicians that are still on their training itinerary. And we started with this at the 3rd year, during the 3rd year of university studies. And with this, here, I want to tell you that with all the strategies implemented, all the trainings, we have everything that we need for the heart strategy, and we have reached 15 to 18 points, which is a very high level. And we feel very proud as a country because we are implementing this strategy, and we are having very good results. We have lowered the number of people that died from cardiac disease, and we have also improved the numbers for diabetes and hypertension. for deaths related to diabetes and hypertension.
La siguiente.
Next
Ahora
one,
hablando
please.
un poco de cuidados paliativos en
And
El
now we will
Salvador.
talk about palliative care in El
Comentarles
Salvador.
que los cuidados
I
paliativos
want
se
to
vienen
tell you,
haciendo. Sin embargo, esta es una oficina nueva.
this is a
donde
new
ya el 2021 ya se iniciaron las normativas, los
where we
lineamientos de cuidados
started
paliativos.
with
Y con esto hay una
palliative, with
necesidad
improving
de la
our skills for
población que
palliative care,
necesita de cuidados
and we have
paliativos,
seen
ya
that
sean
the
personas que tienen
population
cáncer
that
o
needs
las personas
palliative
que
care
tienen
should
enfermedades crónicas
had to get a
degenerativas.
better service.
Entonces,
Both
el
for
60%
people who
aproximadamente de las
are
personas que
who
necesitan
need palliative care
un
because they
cuidado
have
paliativo. Y
cancer
para esto se
or they
necesitó
have
la capacitación al
disabilities
100%.
of a greater
Entonces,
degree.
con
So
esto
we needed a
podemos
better
ver
training for our nurses, and we can see that
se empieza desde primer nivel de atención, luego se
this
puede
starts
enviar al
with the
segundo nivel de
first level
atención
of
y esto es
care,
al tercer nivel de
then
atención para
the
darle las
second level
atenciones
of
a
care,
todos los
then we
pacientes.
have the
La
third
siguiente.
level of care to provide care for all patients.
La siguiente. Aquí un poco les voy a resumir este cuadro. Aquí es solo para decirles que igual se dieron en las 5 regiones de salud.
Well,
Esto se capacitó
this
a hospitales
shows you the
también,
5
algunos ya los
regions
tenían, pero sin
and
embargo se volvieron a
of
capacitar y esto con ayuda
hospital
de
care,
OPS. Se hizo
and
un curso
we did
intermedio en cuidados paliativos
and
para
we
los
implemented an
hospitales, ¿verdad?
intermediate
Porque
course
es
for
más
hospitals with
especializado
PAO
y
that
se
is
hizo
more
unos cursos
specialized,
básicos de
and
cuidados
we
paliativos
also started with some
para
basic
primer nivel
courses
de
of
atención.
palliative
Entonces,
care for the
hemos hecho
first
una red, tenemos
level of
31
care.
hospitales, ¿verdad? En el país y hemos hecho la
We have 31
27
hospitals
unidades de
in the
salud
country,
en primer nivel de atención
and
con la red
we
hospitales.
have
Entonces, esto
and we
va
did
así.
this course
Luego
with the
hemos
first level
también
of care
capacitado
in
con
all
estos
hospitals, and
cursos
we have also
a
trained
la seguridad
with
social.
these courses
Hemos
the
capacitado
social security
universidades,
staff.
¿verdad? Que
We
hay un
have
está
also
involucrado en
trained
esto, las
university
ONG, los
staff, the
especialistas, por
NGOs,
ejemplo,
also
el Centro de
the military
Rehabilitación,
hospital, the Center
importantísimo
for
para nosotros,
Rehabilitation,
algunos
and
policlínicos del Seguro Social.
some
Y con esto hemos ido
of the
avanzando porque con estos
social
cursos tienen que
security
tener curso de
establishments,
cuidados paliativos total
and
en el
all of
curso
these have to
de
these
OPS,
all this
¿verdad?
staff has to
Y
do
con
the
esto
palliative
hemos
care
hecho también un
course.
híbrido. La siguiente, por favor. Hemos hecho un
Next one,
híbrido porque
and we have set a
esto es
hybrid
teórico práctico. Sin embargo, en
a
las
hybrid
últimas
course, set up a
capacitaciones se
hybrid
hizo
course
que
because it's
primero tenían que hacer
theoretical
el curso
and
virtual
practical.
y luego posteriormente
So
tenían que
they
ir a
had
hacer
to
las
do the
prácticas en el
virtual
Hospital Divina
course, and then they had to
Providencia,
go
que es
on to
el hospital
practice in
especializado
the
en cuidados
Providence
paliativos acá en
Hospital,
El
that
Salvador
is
por
the
el momento, ¿verdad?
specialized one in
Entonces
El Salvador.
se han capacitado más de 500 recursos entre los recursos humanos de hospitales y los recursos humanos de primer nivel de atención. Con eso pretendemos nosotros mejorar, ¿verdad? Esta red de cuidados paliativos desde primer nivel de atención y hasta hospitales y darles a las personas, ¿verdad? Una mejor calidad de vida en su final de vida, ¿verdad?
To provide a better
So we
palliative care
feel
at the end of life.
satisfied because this is a course from PAHO, and this has been fundamental for us. This has been of obligatory fashion, and they need to perform this in their hospitals or their healthcare units. Thank you.
Muchísimas gracias a vos, por favor.
Thank you.
Excelente presentación.
This was an excellent presentation.
No solamente la
Actually,
innovadora en
not
cuanto a
only the
formación,
innovative problem or a factor on innovation, but also through virtual mechanisms. And I thought that these presentations were quite interesting because we were incorporating processes and problems that were focused on primary health care. And health was talking about palliative care, and this shows the nature Minister of Primary Health Care, where we're not only thinking about strengthening the primary health care, but also on their coordination roles. Honestly, I loved this presentation. I want to congratulate the Ministry of Health, particularly from El Salvador, and this is extremely pertinent. Now, I am going to tell you a little bit about this session. This is a questions and answers session. And we have 1,300 people connected. And people are quite active. They are participating in an incredible fashion on the chat box with questions and answers, lots of comments. I would not like to forget mentioning that some of them were telling us they were not looking at the presentation. I was looking at the presentation, so probably maybe you guys are having problems or internet problems. We are recording. We are going to be sharing the presentation. We're going to share this on social media. And for those that have had connection problems, I'm sure that you're going to be able to see this in details. Ernesto, just to tell you that El Salvador colleagues have a second part of the presentation. So it's just only 4 minutes. Okay, well, this is just 4 minutes, please. I'm sorry for the El Salvador team. Yes, good afternoon. It's a pleasure for us to be here with you. And I wanted to show you a little bit about the results that we had in the implementation, and I cannot stop thanking our PAHO team, but also the Washington office, as well as the Ministry of Health and our authorities, because this is a political commitment. Just quickly, I wanted to tell you our objective. First of all, first healthcare is the entry to the system. Right now, we have 894,435 adults. We are in a phase of ageness in phase 2 and 3. We need to focus on taking care of our elderly. We have a projection that it's growing. So for us, it's important to consider the human factor. President Nayib Bukele has been actually a relevant key role in this, because we needed to properly educate geriatrics and gerontology. And we don't have lots of doctors to take care of these adults. We need to provide abilities or skills for them to take care of the elderly in any scenario that they're in, and promotion of health and prevention of diseases. It's definitely important to have the personnel of these skills. When it comes to 2015, we have the Inter-American Convention regarding protection of the elderly. El Salvador ratified this convention, and in Article 19, they include the elaboration of education courses when knowing pathologies, particularly for treating chronic diseases. That means that the elderly, considering this, they comply with the goal. In the pandemic, this was quite a field as an ally. We included the implementation of the standard or the technical standard, and we would like to remember you that we train human talent, and this would be key to have truthful results and indicators when it comes to health. On 2020 and 2021, we approved the Decade on Healthy Aging, and in 2022 we have the new Special Act for Protection of the Elderly as well. In 2023, and we started working with the Washington office from year 2021. I believe that it is important that we start analyzing the opportunities for these potential professionals to have the competences according to the health of these adults. And we had an agreement with the Health Panam organization, and we were trying to strictly comply with this act. Would these include also an institutionalized aspect? And we included other politics that was key for human talent. In year 2023, we launched the National Politics for Cares in El Salvador, as well as in 2024. Why is this important? If these courses are not guided from needs that we have properly identified, we consider that promoting central care based on the elderly, on respect, dignity, and human rights is key to transform the personal role of health as agents of change in order to promote aging in a proper way. We need to contribute to care, recognizing the value of work, and we need to strengthen technical competitions to apply protocols, operational guides, and develop competences to identify risks, needs, and opportunities of improvement. We need to propose resolution strategies to tackle complex problems, no matter where we are, either it is primary level, secondary level, or specialized level. The importance of this care focused on the elderly is the ground zone. We have management of chronic diseases and support as well. The guide is basically training personnel. We have the support of the Washington office. And here we could see the PAHO node that have supported us throughout all of this effort. We have results as well of this implementation. Up to this moment, we have 2,274. In El Salvador, we have an evidence on the authorities, particularly for the people that have a real commitment. El Salvador in year 2024 was chosen for piloting this, and professionals are following strategies of training the personnel. And this is currently integrated to all the health system, social safety, military, ministry, health minister as well. And at this time, we have doctors, nurses, odontologists, all of them are relevant. They are the eyes of our communities, and we're betting on the community workers as well to adapt and identify risk on our adults. We have all of these people that have subscribed to our courses. We need to extend flexibility, and this is something that we include in this virtual center. We need to extend all of our resources for those that have included personnel without including a geriatric doctor there. These are people that are empowered according to the current standard, generating changes as well. And it's important to generate changes in behavior, and we need to fight negligence in care. A strategic alliance has enabled to extend coverage, sharing resources, and generated a sustainable impact in the health of people. We need to identify early factors of risk like falls, polypharmacy, social isolation. We need to fight isolation as well. Awareness on human rights has enabled to enable ethical standards in training processes, implementing routes of integration care in the reference and return has enabled this link. So we believe that the people that are in the first level of care, how do they come back here? For example, in this case, implementation of integrated attention care has enabled linking the first care level to guarantee attention of healthcare. So
the main lessons learned depend on the characteristics of the region. For example, the accessibility of technological resources, the installed capacity, the different epidemics that are there in the region. And so you can develop the course or adapt the course to what you need. And we see also the limiting factors. For example, we had to go over the data, the personal mail addresses, the institutional mail addresses, and we had to monitor the results in order to be able to adapt the courses according to the goals. And the good practices that we identify are the following. We identify the early detection of risk factors for the elderly, such as falling down or too many drugs or social isolation. The sensibilization according to human rights and active and healthy aging, the implementation of ways to provide integrated care, and also the accompaniment and technical assistance. Thank you very much. Thank you, Lydia. This is very impressive, Nydia. Congratulations. I was very much impressed by your presentation and by the experiences that are taking place in El Salvador. I don't know if you had the opportunity, but I was looking in the chat at the reactions of the rest of colleagues that are participating in this space, and obviously it's not only the reinforcement of how interesting the presentation is, but also it provides a great model for other countries and also about the way to share their own experiences. And this is the goal of this meeting, to establish not only a sharing of the presentations, but also a dialogue and to be able to learn from each other. And so now we go on to the Q&A session. The first question is for Gustavo. I hope he's there. Gustavo, many healthcare workers associate primary healthcare with prevention and promotion of the first level of care. Can this course allow us to understand that PHC is a broader strategy that really encompasses all stages of life? And the presentations showed us that. And all the systems of healthcare, it's not only a primary level. Gustavo, can you tell us a little bit about this? Yes, thank you for the question. The course is an introduction to primary healthcare, but it also explains it as a strategy that accompanies people along their life and integrates public health and also clinical care. It includes the institutional framework of primary healthcare, operational framework, and which means that we have to transform our knowledge into action. And it also includes the participation of communities. So this point of view allows healthcare staff to understand their role and to see what their itinerary implies along the life of their patients. Apart from the operational facts, for example, such as prevention, etc., and the palliative care, and all this is seen from a holistic point of view. And to answer other questions, this doesn't mean that this course provides all answers. This is why we talk about an itinerary. And so you ask us where the traditional medicine is included. Okay, so we find different points in this itinerary where we can develop these skills and also the knowledge we want to acquire. I hope that I have answered your question. Thank you, Gustavo. I think that you that you provided a perfect stepping stone for Isabel, because you provided the link between the course we're showing and this strategy and cycle of formative itineraries. So we have the next questions you did for you. You did an explanation of the itinerary as a path that allows you to develop very different skills. Well, in reality, as I was talking about this, we have to follow the framework of analysis, and it's still an interprogrammatic work, and we have to work with the authorities of the country in order to identify new gaps that have to be filled. Not the ones that are there right now, but also the new ones that might arise. And we also have to look at new proposals, educational proposals that come up from our partners. And because educational itineraries are led by one of the specialized areas, but the courses are part of the whole organization. So you will find courses developed by different technical areas, and our organization has a policy centered on primary health care for all areas of care. And the ideal issue the ideal effect would be to have a team that embraces continuous learning and is always aware of the different areas where they can develop new skills, and analyzes the new proposals for the virtual from the virtual campus. And it provides different opportunities also for all actors at the level of the country, regional level, our directors also, and this is a continuous it's a continuous job. We have to always be aware of new changes and update our courses. Thank you, Isabel. I have to thank the virtual campus for providing us their support as a technical area in this case, and your presentation is very clear, and your answer also. So now we have a question for Benjamin. How does PAHO propose to strengthen these skills that you were mentioning in your presentation about human resources through the formative itineraries, the educational itineraries, and also ensuring active learning, and as you said, also to the possibility of setting up teams, interprofessional teams. And in these strategies of primary health care, How do you do that? Well, thank you, Ernesto. Stressing the fact that we're not talking only about isolated courses, but we're talking about itineraries. So this means that you can look at it from a more comprehensive point of view, and that's a proposal not only from us at PAHO, but also from the different communities. And as Isabel said, it's not limited to a certain technical area. And now we're talking about primary health care that really encompasses all different tasks. And it also means that we have to develop training courses and itineraries where they in order to learn how to apply all these issues, to implement all these actions. We need interprofessional education for our healthcare providers, and this means that we have to continuously examine what we are doing and improving the areas that need improvement with the formative institutions. And this interprofessional education means that we have to work with teachers, and not all institutions, educational institutions, have teachers that know about interprofessional education. So when we talk about skills to set up interprofessional teams, we have to start with the teachers. And a teacher of medicine or dentistry, if we talk about a course of 40 hours of duration, is not enough. You have to be immersed in a continuous program for acquiring new skills. And this is a very powerful tool that allows us to set up processes in time, and also provides for the possibility to acquire these different skills. Thank you. Thank you, Benjamin. Very clear. And now we need to close. I believe that the questions and answers of different colleagues provide clarity about what we are doing at PAHO. And I will ask one question, and that summarizes everything, which is not easy. The presentation from El Salvador has been very informative. I leave the colleagues of the possibility, the two colleagues, are possibility of answering my question. And well, although both presentations were quite specific, they have insisted on virtual training through the campus. And so the question would be, what are the advantages of an introductory, or what would be the advantages of an introductory course and a formative itinerary? As Gustavo and Isabel and others said, we could focus more on primary health care in your context in El Salvador. How this take place? How did this take place? You can both answer, or just one of you. You have the floor. Well, in my case, I'm in charge of palliative care and non-transmissible diseases. And I believe it's very important to participate in and it's really the first step to participate in the palliative care course in order to decrease premature mortality, for example, and because of diabetes or heart disease. And this network is already set up, so we have seen that there are not enough people specialized in palliative care. So the primary healthcare level has been a basic issue in order to identify people that need palliative care. We also need nurses that know how to provide continuity to these treatments through clinical care. Nurse can provide palliative care perfectly through the connection of to the different blood pads, and PAO has always provided the tools necessary for developing the skills of our human resources so that they can learn every day. And our authorities should also be aware of these programs, the presence of these, existence of these programs, and that they provide us support in order to be able to continue with these courses for the benefit of our population. Dr. Cañas, I will add that this type of tragedies that are directed to improving primary health care are really fundamental in the different local contexts and at international level. For us, as in geriatrics and nursing, the ways of tending to the elderly are different. We have to, apply an interdisciplinary approach for the elderly. And it's very important to have to take these courses in order to be able to identify the different dangers that arise for the elderly, because the elderly are part of the community, and it's in the community where they should live the last years of their life with quality of life and good care. And so this is one of the main tasks of public health, to provide care for the elderly, and because this is our path in life, and it's the largest part of our life usually, and the longest one. And so we have to provide our adult population good care during the last years of their life is a key factor, and public health is in charge of that. And we have to adopt a critical point of view in order to identify the areas where we have to, where there are still areas where we are not that good. We have to really work on that as a country. Thank you very much. It's really great to hear that you are focusing on public health and providing a formative course in public health. It's really, this presentation by El Salvador was really great. I have to mention also, because you have put it on the table so clearly, but the office of PAO in El Salvador has a fundamental role, has played a fundamental role in all this. So congratulations, and also to the representative Marcelo Cort. And I also want to thank Juan Fernando Garcia for his presentation, from Colombia, for his presentation. And we had a very comprehensive seminar. In the case of Isabel, it allowed us to focus on certain messages that have to do with the importance of the formative itinerary in the case of primary health care, and that is really essential, the essential part of our seminar. It's a very relevant path. It should be flexible and progressive and structured with a certain coherence in its conception. And it should also promote the participation not only of different technical areas, but different actors also, and with a strong participation of actors at local level from the countries, so that in order to guarantee that it makes sense, that it is pertinent for all contexts. Gustavo's presentation has been, from my point of view, brilliant, because it has to do with the content of the course, where the context is provided. What we call primary health care, its its history, when it started, and how these principles evolved, and how they end up being the pillars of our transformation processes in this century, taking into account the challenges and the challenges of our present century. And Gustavo began telling us about the principles and the logics behind the implementation of primary health care and the important role of the territorial approach. In the case of Benjamin, well, he did a very broad presentation about human resources, and both his presentation and his answer were focused on central issues that have to do with the skills of human resources in primary healthcare. And this is not only about techniques, but also the teamwork, leadership, communication. And well, leadership is fundamental in that sense, because we are thinking that we should take into account that primary health care is not only a microspace in a health center, but it is these are change processes that have to have an impact on the formative structure of the whole system. And this is also linked to Gustavo's presentation, and it allowed us to understand the more important concepts, the more structural principles. So, and the presentation of Juan Fernando Garcia and the experience of the Colombian Node and its component of centered on mental health is very inspiring because of the focus on mental health, because we know that mental health is one of the most important problems we have to deal with, and in some way it became a broader problem for public health after the pandemic. And the experiences of El Salvador were really fantastic by both our colleagues, fantastic experiences that incorporated not only the role of primary health care and how to organize different processes of care, and the focus on life stages. And this showed us a capacity for innovation and commitment that was really impressive. I would like to finish with a few reflections. There is no doubt that our region provides a consensus where we interpret primary health care as a central strategy for transforming our health systems because there is a commitment for equality, for integration, and for resilient health systems. And this is where the educational itinerary makes sense because it is linked to the strategies of primary healthcare that the countries are implementing. And I would like to say that on September 15, we will launch a document that has been jointly developed by the Development Bank and the Pan American Development Bank and the World Bank. That is very important because these types of documents will also be part of the formative itinerary, and of course, they focus also on the strategy of primary health care from a territorial point of view, because it's one of the main points. I won't tell you more because more about this document because on the 15th of September we expect you all, and I would like to thank you for connecting to this conference, or for asking your questions, for making comments, and to our speakers. Thank you very much. Thank you very much to all. Thank you.